I'd like to give you a brief overview on arthritis and what you need to know. With arthritis, unfortunately, all of us, if we live long enough, are going to be afflicted by some form of arthritis. One of the most common types is osteoarthritis, which is otherwise known as a wear and tear arthritis, but there are also many inflammatory type arthritis. One of the more common ones is rheumatoid arthritis. Basically, these all fall into the same category of the cartilage surfaces in that joint are just wearing away. And we oftentimes use the term bone on bone. What does that mean? That means that the shiny white cartilage, for example, at the end of a chicken bone, is now worn out, and you're having raw surfaces of bone rubbing on raw surfaces of bone. And you can imagine that would be quite painful. And that's oftentimes why you would come to see an orthopedic surgeon, because a lot of times that requires, after the failure of medicines, injections, a lot of times surgery. What are the ways in which arthritis can be managed? Let's start with the simplest. A lot of times we might use over-the-counter medicines such as Tylenol or Tylenol arthritis. Then you move on to things like anti-inflammatory medicines, as long as there are no allergies or drug interactions. Things like ibuprofen or Aleve are some of the common over-the-counter medications. Then we can move on to topical medications. You can use things commonly known as icy hot or things like pain relief salves. One of the common things that's also now being used, it's now over the counter, is diclofenac gel or Voltaren gel. That's a topical anti-inflammatory you can rub onto the affected area, usually twice a day, and that can sometimes help. What if that doesn't help? Then you usually go to see a specialist, and then we would usually do x-rays or some other imaging to determine that yes, indeed, you do have arthritis and that something else might be offered. Sometimes that would be injections. If it's really inflamed and painful, occasionally a corticosteroid injection, or that's commonly known as cortisone. Or there are these gel injections or hyaluronic acid injections, which act like a lubricant, which can sometimes alleviate symptoms. But sometimes that's not enough. And in those instances, we have to say, is something else amenable? In terms of surgery, would arthroscopy, which I have to caution not always is amenable for arthritis, or you need to have some sort of a joint replacement.